Yeah, welcome. Thank you. This evening's event is focused on basic income and the social determinants of health. As I'm sure most people are saying, these events, the research seminar series, feel like sort of late afternoon events in the summer, but in the winter they definitely feel like an evening affair. So thank you so much for joining us this evening. And yeah, this is the last of the bi-monthly event of the year. Do introduce yourself in the chat. You can access that throughout the event. That's fantastic. And whether you're joining us live or watching us back on YouTube, thank you for being here. Please, we use these research network events to invite experts, and I couldn't be more thrilled to welcome our panel of experts today. We have a fantastic group of speakers talking to us about the social determinants of health and how that intersects with basic income today. And yeah, because we have our expert panel, we do have this set up as a webinar. So if you want to ask a question, please do put it in the Q&A and we'll call on people as we go through. The last half an hour will be an audience Q&A. So I'm just going to invite our speakers to introduce themselves now. So Matthew, do you want to go first and introduce yourself?
I'm Matthew Johnson. I'm Professor of Politics and Policy at Lancaster University, and I suppose my interest in UBI and health is a really quite recent one. So I've been working with Kate and others on this for the last few years.
Thank you, Matthew. And Kate, do you want to introduce yourself?
Sure. Hi, everybody. Good evening. I'm Kate Picket. I'm Professor of Epidemiology at the University of York. My research focuses on the social determinants of health and health inequalities. And I am interested in people's livelihoods and universal basic income as a potential tool for improving health and well-being. Really happy to be here tonight.
Thank you. We're delighted to have you here. I know your books have been very influential in many people's work and view of inequality and basic income. So thank you for being here. Michael, do you want to introduce yourself?
I'm Michael Marmot. I'm director of the Institute of Health Equity at UCL and have been very much involved in social determinants of health for a long time.
Absolutely, and yeah, also delighted to have you here. Big figure in understanding inequality, certainly in the UK and globally. And yeah, Matthew, great to have you here too. I know you're doing some very important work on basic income and the pathways to affecting health, amongst many other things that we're really excited to start putting out into the world soon. Laina, do you want to introduce yourself too?
Lovely to be here. I'm Laina. I have recently started at the Basic Income Conversation as a campaigner. I will be moderating tonight's event, so stick all your questions in the chat, or if you want to message me directly, that's also fine. And I'll be rejoining everyone in the Q&A section of the last part of the event.
Yeah, very thrilled to have Laina here for her first Basic Income Conversation event and as our newest member of the team. Do, as she says, pop your questions in the Q&A feature or directly contact her and she'll ask you if you want to come on screen to pose your question later on. So yeah, just briefly before I hand over to our speakers, I don't think, as I said, we could be joined by a more clued up panel or asking a more pertinent question than we are tonight. I think how a basic income could improve our health really cuts to the center of the argument. Basic income is something that we position as something that could improve the lives of people, in the UK or wherever it's implemented. And I think the root of it affecting our health, our mental health and our well-being is kind of how it would do that most crucially. And the second reason that it's a pertinent question is obviously having lived through a public health crisis over the last 2 years or so. I think we're all much more tuned into how our health is related to social factors. COVID has made the social factors more obvious to us all, particularly people who are less affected by inequality, who, normally we're talking about how systemic factors affect other people, but I think we've all been in it kind of together in a way that we haven't necessarily always been. And that has also meant that basic income has been put on the agenda in a way that it hasn't before during this crisis. And perhaps that window is closing, the window to talk about things like basic income as we return to normal in theory. But I think it's certainly the time to be having that discussion and to be trying to make shifts that prevent situations like the one that we are put in arise again. So that's enough from me. I'm going to pass on to Michael to do the first bit of speaking. Thank you.
Thank you. In 2010, we published Fair Society, Healthy Lives, the Marmot Review. I was asked several times at the time, isn't there only one recommendation? It's just about money, isn't it? Having enough money. And my response was, money is very important. But if I thought it was only about money, I would have had only one recommendation. But I had 6 domains of recommendations: early child development, education, employment and working conditions. Number 4 was everyone should have at least the minimum income necessary for a healthy life. Number 5 was healthy and sustainable places in which to live and work. And number 6 was taking a social determinants approach to prevention. And I think they're all important. As a research nerd, I could ask, well, if you pop income into a model with health as an outcome, and you put education and markers of deprivation, which survives in that multivariate analysis? And we can argue endlessly about whether income is vital or it's just correlated with other things. But when I look more broadly, globally, if you look at the Preston curve, which for countries, which puts gross domestic product per person adjusting for purchasing power on the x-axis and life expectancy on the y-axis. And for example, we did it when I led the Commission on Equity and Health Inequalities in the Americas. If Haiti was a bit richer and had the same income per person as Bolivia, it's likely that life expectancy in Haiti would approach that in Bolivia. If Bolivia got a bit richer, let's say up to the income per person of Brazil, it's likely that Bolivia's life expectancy would improve closer to that of Brazil. And if Brazil got as rich as Costa Rica, then it might well be that its life expectancy would improve to that of Costa Rica or Chile. But then when we go all the way out from Costa Rica at about $18,000 per person, adjusting for purchasing power, to the United States at $60,000 per person, there's no relation between national income and life expectancy. And that's pretty important. So money's important. If you haven't got any, as a country or as a person or a family, having money is pretty vital. Above some threshold, it's not the money per se that's important. It's what you're able to do with the money. And that relates to a whole set of other things that communities provide. You can have upper middle income, but if the air is not clean, you're going to suffer from the lack of clean air. If the water is not fit to drink, you're going to suffer from the lack of clean water. It's not just individual income above that threshold. Now, what about giving people money? Well, the experiment's been done in Latin America on conditional cash transfer schemes. And if you give women in families money, the health of their children improves. Wow. Infant mortality is less. Diarrheal disease is less. Now, these contingent cash transfer schemes are not really what you'd think of as basic income. They're giving people money contingent on their doing certain things, taking children to nutrition clinics and health clinics, older children remaining in school. And there's a debate about whether you need the contingency or whether just giving money without the contingency would have the same benefit. And I don't think that's sorted. Some claim it does, others say, no, you need the contingencies, or the conditionalities, the conditional cash transfer schemes. But giving poor people money is quite good for their health because they can afford things they couldn't afford before. What about then universal basic income? I know of 2 experiments that call themselves UBI, but aren't. One is the Finnish one, which is giving unemployed people money. It's nothing like universal. And the other is the Welsh one that's being planned, which again is nothing like universal. It's giving at-risk school leavers money. And I think it's a good thing to do, and to evaluate the health benefits of that, but it's nothing like universal. So it seems to me there are 2 questions here. One is basic income, and the other is UBI, universal basic income. And you could make the case that in a poor country, universal basic income is quite a good idea when there's vast numbers of people below the absolute poverty line. If you were going to propose it in a European country, or a country that used to be a European country, like the UK, if you're going to propose it in a rich country, then obviously you've got to ask the question, if it's enough money to make it realistic to live on, what are you going to give up to do it? Are you going to scrap a whole set of other welfare programs? And so what are you going to give up to do it? The fact that we have a remarkably stingy welfare system, damages people's health, no question. And I don't think it was just the stinginess of our welfare system from 2010 that led to a failure of health inequalities to get smaller. In fact, they got bigger, a failure of life expectancy to improve, and life expectancy for the poorest people to get worse. I think it was austerity much more generally, including stinginess of the welfare system, but a decline in funding of public services, regressive nature of the cuts to local government. All of those are likely to be important. So having enough money is vital, no question. And that's got to be an entitlement, not charity, but an entitlement that goes with living, being a member of society. Whether it should be universal, it seems to me the jury is still out.
Thank you very much, Michael. Kate, I'm going to hand over to you now.
Thank you. Always a hard act to follow, Michael. But Michael's raised the issue of, what do we mean really by universal and basic income? But I want to focus just on the word income for a minute, actually, because I think when we're thinking about income and its impact on health, we can think about absolute amounts of income, does having X amount of income affect your health or not? We can think about relative amounts of income. Does being in relative poverty damage your health? We know it does. So we know that absolute levels of income improve health. We know that relative amounts of income are related to health. If we put them in the same model as Michael suggested, sometimes, quite often, we find out that it is the relative amount of income that is more strongly related to health after controlling for the absolute amounts of income. There's some evidence, it's less clear cut around stability and predictability of income, that matters for health. And I think we can take that back to the very early studies of unemployment and factory closures, and realizing that those had an impact on mental health and physical health even before people were made unemployed, as they started to realize that their incomes were becoming unstable, that they were being threatened. And then there's also the symbolism of income. what income means, what it says about you, what it means to have an income or not have an income, access to things. And Matthew and I have been doing some work together, and I'm sure he'll talk about it later, around the pathways through which all of those different aspects of income lead to health and well-being through mechanisms that are related to stress. So these are very familiar to all of us who are interested in the social determinants of health, that it is the biology of chronic stress that underpins those relationships. And income, of course, has material aspects. It has effects on our biopsychosocial well-being. So it might mean we can afford more things, but it might mean we feel better about things or less stressed about things. And it might affect our behaviours as well. And I think key to that, when we're starting to talk about universal basic income in a UK context, would be whether or not some kind of UBI might improve people's sense of agency or control, their self-efficacy and their self-esteem, and that these might have consequent effects for health and well-being that would be measurable, and perhaps mean that a universal basic income were cost-effective in reducing long-term impacts on mental and physical lack of health. The jury is out. Michael's right. We do not have good trials of what people would truly term universal basic income. We have lots of trials and studies of various kinds of cash transfers in different kinds of settings. I'm aware of a forthcoming review of economic transfers for mental health that includes 29 studies, and overall shows a small but a robust positive effect of those cash transfers on depression, on happiness and life satisfaction, particularly for younger recipients. What Works Scotland has reviewed universal basic income as well, and concluded that the trials that are out there of various cash transfers show positive effects for low birth weight reduction, for adult and child mental health, for service use and for diet, but also for things that indirectly then affect health, like quality of parenting and offending. So I think we could theorize a broad array of impacts of universal basic income. And so its potential as an upstream health intervention, I think, is defensible and clear. But how do we get from thinking that to actually knowing that this is true, or showing that this is a, sorry, that's my clock that's pretending it's a bird, if you can hear it in the background. I haven't actually been invaded by a flock of sparrows. But the practical and policy implications, that they are large. So in my own work, and I work quite a lot in Bradford, which is one of the most deprived cities in England, it's the 5th or 6th largest city, depending on how you count things, with high levels of deprivation, and it's got one of the youngest populations of any cities in the UK. We have been thinking about universal basic income, or a cash transfer, a universal cash transfer for young people, as a mechanism for improving health and well-being, for several reasons. One is that we know we have very high levels of poor mental health among young people in the city, very high levels of depression, and we know we have very high levels of unemployment as well, and young people being not in employment, education, training, or entrepreneurship. And so we have been thinking about whether or not some kind of payment scheme for young adults, and we've been thinking in the sort of 18 to 20 year range, would be a way of improving their health and well-being as they make that transition from childhood to adulthood. Now, that's a really important transition in our societies. So going from childhood to adulthood is when you move from being a dependent to hopefully being independent. It's when you make a move from being usually part of a family to sort of seeking your way in the world on your own. And lots of people would agree that at that point, young people are particularly vulnerable to not succeeding. You know, it's quite hard to make that transition. They are anxious about making that transition, and it's certainly not a level playing field for our young people. So those who come from secure backgrounds with a lot of parental support find that transition much easier than those who are coming from a more deprived background or live in areas where there's less opportunities for employment or apprenticeships, etc. And so we're thinking about income support for those young people because it's an important time where a small amount of money might do a large amount of good. And when we're thinking about universal basic income, we never define it. We never say, oh, it means an income of a certain amount. Michael's talked about sort of minimum income for healthy living. With young people, I think we could think about quite small levels of universally available cash might make quite a large difference if they were stable and if they were predictable. And we might be able to prevent young people sort of falling off a cliff at that point when they transition from childhood to adulthood at fairly low cost to society, even if all young adults were to be provided with a universal basic income of perhaps something like £60 to £100 a week. We think it's more feasible and acceptable to think about universal basic income for this age group for all of those reasons that I just suggested. It's a key time of vulnerability, and also British people tend to feel that children should have an equal start in life or an equal chance. We tend to be more willing to sort of support the idea of levelling up and creating level playing fields for children and for young adults perhaps than we do for adults themselves. So small amounts might make a big difference, and they might make a lasting difference. Because if you've got that transition to adulthood right, if you were able to prevent mental health problems, addiction problems, long-term unemployment at that ages, that might have a really long-term payoff throughout people's lives. And I think COVID has sharpened our interest in this because it has shown us how important being engaged in society is to people, how damaging it is not to be in education or not to be engaged in work. And so it's perhaps made us think a little bit more keenly about this, as has the 0 hours culture. That's made us think, I think, a lot more about stability. So I'll finish in a second, but we've really been thinking hard about how you design a study that would tell us first whether this was acceptable and feasible to the population where we might want to make this intervention, whether it's feasible to actually do this without affecting people's engagement in employment, education, etc., whether we can actually make the payments, whether it's practically possible to do it. And then, of course, we would want to know if it had the impact on sense of control, agency, self-efficacy, mental health and well-being, and all the other outcomes we're interested in. It's very hard to think about how you design a study like that, because if it's not universal, how can you study the impact of universality? So it's really tricky to think about how you would actually design something that is not universal when you're trying to figure out whether a universal cash payment does work. So at very, very early stages of really thinking about robust designs, even for a pilot study, but we are keenly interested in it and in thinking about what a robust design and a robust evaluation would look like. Unfortunately, it's probably even easier to think about those things than it is to think about funding the payments themselves. This is not something that we've been able to get research councils interested in. Matthew will describe some of the work we're doing in Wellcome Trust, who are more interested, but I think it's going to take philanthropical investment in pilot studies for us to be able to sort of take this to the next stage. But I think it's an important conversation for us to be having. I think Michael's point about the jury being out is a good one. We don't know whether universal basic income is more important than universal basic services. There's lots and lots of unanswered questions. We don't know how much a universal basic income should be, who it should be paid to, should it be lifelong? But these are all empirical questions worthy of debate, worthy of discussion, and worthy of testing, I think. And to me, it's about trying to see how we can align public policy with the ways that people want to live, want to work, create, care for one another, etc. And we've had a lot of old models, and perhaps it is time that we were thinking about new models as the world of work changes, as the world of automation affects job opportunities. I just think we should be debating all of these things and taking them very seriously.
Thank you. Thanks very much. And do remember to put your questions in the Q&A box, and I'm going to hand over to Matthew just now.
Thanks very much, Cleo. So that's an even bigger challenge to follow both Kate and Michael, but I'll try my best. And in what follows, you may get a sense that this is a sordid Yorkshireman Monty Python description of the case for UBI, since I'm going to be referring to family members and family and relatives, friends, these sorts of things. But I guess can you see my slides there? Yeah, brilliant. Okay. Well, the reasons for doing that are several-fold. The first being that at least you've got the authority to talk about family members, and I think what I'm going to try to do is to talk around the examples of potential health impacts in tangible lives, because I think in many different ways the left and proponents of transformative public policy more broadly have failed to make the case for the relevance of these public policies to people's lives. In the 2019 election, there was I think it was the first debate, there was a cleaner from South Wales who raised the question about how the country could afford the public policy spending that both Labour and the Conservatives were planning or committed to in the manifestos. And the response to that really ought to have been that cleaners are incredibly important to our society. Our society can't function without cleaners. Cleaners need to be paid well, and it's in everybody's interests that they're paid well. But instead of presenting that response, there was a much more convoluted description of the importance of fairness or values of justice, social justice, these sorts of things that didn't really get to the heart of what it is that drives people sometimes to understanding the value of public policy. So I'm going to try to talk through some tangible examples of the way in which UBI might affect different people within our society. So I guess the first thing to say is that in working with Kate, we've identified from the literature a theoretical model of impact, which really does, well, it's pictured here, and you can find it through the link to the project website.
Matthew, could you maximize your slide there so we can see it a little bit better? Thank you.
So it's hidden behind. Here we go. Let's see.
There's one in the bottom right as well, I think.
Bottom right.
Just next to the left of the minus sign.
Sorry, it just takes ages on this laptop. There you go. Right. Okay. So we've got here the model of impact, and you can find it on the project website. In essence, we identify three prospective pathways to impact. First is obviously the one that people talk about most cleanly, which is a reduction of poverty. And that's understandable given that we face a crisis of poverty within our society, which is of course disgraceful given the amount of wealth that our society holds. I think there are two much more important contributions that UBI makes beyond poverty reduction, and that is inequality mitigation and the fostering of predictability in income. Inequality mitigation is important for a number of reasons that Kate can speak to much more clearly than I can. But in a society in which people feel increasingly incapable of escaping dominating environments within their household, within their places of work, within their place of study, a predictable, sufficient income would give people the opportunity to escape those particular environments and pursue different ways of life. Predictability would enable people to increase their perceived lifespan, so they would be able to adopt different forms of behaviour that might foster their health over a longer period of time. There are these three different pathways that are mutually reinforce one another and lead to a whole range of different changes within people's lives. So poverty reduction leads to improved satisfaction of needs, predictability fostering and inequality reduction leads to stress reduction. Both of those different pathways lead to behavioural change, which compounds all of those impacts and leads to people living much healthier lives. But when we're thinking about UBI and the kind of impacts there, often people externalize those impacts and they talk about this being a policy for other people, for them. And when they're talking about them, they're talking about people who live in houses like this. This is one of my childhood and adolescent houses, just on the center right of screen. That's my father and grandparents' house, and 2 doors to the left is my mother's family's house. So this is where we lived until 2012 when my grandmother moved out. So this was a place of great safety and security for me on a council estate in Newcastle that was otherwise rife with crime and violence. That sort of housing was transformative in the 1960s and 70s because it replaced slum dwelling. And for people like my father, that sort of accommodation really was transformative because it gave him indoor baths for the first time. It enabled him to have a warm bedroom for the first time. So this was a really transformative impact. But actually, for the people who are living in this sort of accommodation these days, there are hidden sources of ill health that really need to be understood much more fully. People living in these sorts of conditions, including my grandparents, faced great challenges with regard to heating bills. So more often than not, central heating wasn't used. When it was used, it was often a form of air conditioning where air would be vented through the house. And in the morning when it was put on for the first time, you just get covered in dust. And that dust, unfortunately, would include asbestos particles that was used to line the inside of the boiler system. So what happens in this sort of accommodation is that people just don't put the heating on, and that leads to the development of things like black mold. And when people talk about the smell of poverty isn't just lifestyle smells like fried food and smoking and things like that. It's also mold and damp. And it's these compounding factors that lead to respiratory diseases and to a range of additional behavioral and lifestyle diseases that are extremely impactful. If you've got a low predicted lifespan, if you believe that your life isn't going to last very long, you're less likely to invest in your long-term health, and you're much more likely to invest in short-term hedonistic behavior. People smoke, people drink. And one of the things about our present conditional welfare system is that the conditionality actually creates a perverse incentive for health diminishing behavior. One of the biggest problems in places like this, and it is apparent to anybody who's lived in these sorts of estates, is that there's an incentive to be as inactive as possible. As soon as you demonstrate that you're active, you're likely to have your needs-based benefits, your disability-based benefits withdrawn. As soon as you demonstrate some form of competence, entrepreneurship, these sorts of things, you lose your unemployment benefit. So the consequence is that you get people like my brother and my mother who are completely inactive, absolutely inactive, because they're absolutely scared, desperately scared of having their benefits taken away from them. So what you get in these communities is not just the impact of poverty, but actually the impact of conditionality. These are places in which there is no easy source of paid employment. All of the heavy industry that used to support these communities is gone. It's just not easy to be able to live there and find paid work. So the consequence is more often than not, you need benefits and the conditionality actually compounds your ill health. So you've got this sense of UBIs for people who are long-term unemployed. But one of the other problems that we face in our society is gross inequality of working hours. So this is a house in a street in which my uncle and his family live. And my uncle is in his 60s, so he's a boomer. He, in the 1980s, totally unqualified, but in the 1980s and 90s was able to take advantage of a quite incredible increase in pay in the Royal Mail as a result of the work of the CWU to build up an incredible paid income on the basis of overtime. So in 1990, it said that some workers in the sorting office in Newcastle were, by working 80 hours a week, earning more than Newcastle centre forward Mickey Quinn, which is that's just incredible. And it's addictive. And what it does in those circumstances is to foster zero-sum competition between workers. So what you've got actually in certain public sector bodies in particular is almost a binging on working hours. And for people like my uncle, he spent the last 30 years working 60, 70, 80 hours a week. And the consequence of being stood working for that period of time is just absolute degradation of his joints, vitamin D deficiency because he's never outside. It's lifestyle diseases associated with binging when he's not at work. The consequence is you've got somebody in 60s who needs a huge amount of health support. This is somebody who's worked hard by any criterion, and it is thoroughly unhealthy as a result of that work, and thoroughly in need of the kind of security and stability of income that would reduce some of that zero-sum competition. But so for people like my Uncle Steve, having a pension approaching is reducing that zero-sum competition, allowing him to draw down on his hours. And allowing him to draw down his hours means that there are more hours available for younger people to take up in the sorting office. One of the things that this group of workers has faced is just a decline in living standards. He's earning less, not just in real terms, but in cash terms than he was earning 30 years ago by virtue of the decline in pay in that particular sector. So this is the group that really is wholeheartedly behind things like Brexit, contributed to the rise of Tory vote in red war constituencies in 2019. These are people who feel left behind. They feel threatened and in zero-sum competition, and they need a source of stress mitigation. UBI could do some of that. It could ensure that they've got at least some security that enables them to invest a bit more in their well-being. Finally, you've got this group that live in fancy new build developments like the one that I live on in the north of Newcastle. And what you find in these communities is that parents have good jobs. They've got good enough jobs to pay huge mortgages. Some of them have sent their kids to private schools. Lots of the kids will go on to university elsewhere. The big challenge for people who own these sorts of houses is that their kids are going to be long-term unemployed. In effect, higher education conceals the crisis of youth unemployment in this country. And what we've seen in recent years, and what's apparent in our graduates, certainly some of the graduates I come across at Lancaster, is that people spend a year, 2 years following graduation, unemployed, doing unpaid internships, having to do further study, spending much of their 20s either at home or in poor accommodation in the big cities. So all of this creates a generational divide in which you've got an unforeseen middle-class precariat among young people who are increasingly dependent upon their parents for employment. And frankly, I suspect I'm going to be working until I'm 70 to pay for my kids. I mean, that's just likely because I think there are going to be fewer opportunities for self-sustaining employment for young people however hard they work. That's going to contribute to a crisis of stress. And for anyone who's been in higher education over the past few years, it's been apparent that students are increasingly stressed, they're increasingly ill, they increasingly present with autoimmune conditions that may have a connection to long-term exposure to stress. This is a generation of kids that people would assume would be privileged, but actually is going to face a whole series of challenges that really were unforeseen. UBI can promote the interests of those kids long-term, reduce stress, and ensure a degree of independence that might enable them to invest a bit more in their long-term health, change some of the behaviour that would contribute to that. So these are 3 different lives that cover a large section of British society, and they go beyond reference to just simply the lumpen proletarian long-term unemployed. So UBI really is of relevance to a whole range of different people within British society. Thank you.
Thank you, Matthew. That's fabulous. Brilliant. So I'm going to ask a couple of questions, and do keep adding your questions into the Q&A box if you have one. We'll be calling on people shortly. Really interesting to hear the sort of conversation around conditionality. I think, Michael, you brought it up initially, and you know, cash transfers, we have quite a lot of evidence on that, but those tend to have conditions on them in addition to the money being given out. And Kate, it felt a little bit like you were saying the kind of dignity that comes with the idea of something like a basic income in part comes from the lack of conditions on it. But yeah, I'm just keen to hear a bit more, maybe if we start with Michael, on what you think about implementing something completely unconditional without much evidence on how that functions from a health perspective.
Well, all my instincts, if that's the right word, are for universality. In my 2010 review, we coined the term proportionate universalism. We said we wanted universalist policies with effort proportionate to need. And so that, you know, my response is not to say, let's have means tested benefits, let's not have conditionalities. My priors are towards universality. What I think we heard from Matthew and Kate was targeted at school leavers. For example, Matthew talking about in the third case, it wasn't at the parents were doing fine. It was at the school or university leavers. It was targeted to a particular group, and that may be perfectly reasonable. It didn't sound terribly universal. Now you could say, well, I meant universal for everyone in that age group. Okay. I mean, that would fit with my instincts. I mean, I'm concerned that in London, it's a few years old, if you look at the level of childhood poverty, where poverty is defined as less than 60% median income, before housing costs, 17% of children were growing up in poverty. After housing costs, 37% were in poverty. So if you're going to say, look, what people need is money, well, yeah, they need money, but they also need affordable housing. And that's the best way to get affordable housing is not necessarily to keep piling money on the individuals, it's to do something about the supply of affordable housing. Because we know that you pile money into the individuals, it just goes into the pockets of landlords. We've gone, as certainly in London, there's dramatic shift from social housing to the private rental sector. The private rental sector makes nice profits for landlords. In general, the quality is worse of housing, and it creates poverty. So that's why I don't think of it only as the supply of money. It's the supply of affordable housing. It's healthcare free at the point of use, the fact that university education is now an enormous tax on individuals and their families. You know, we accepted this as available to all, and it isn't anymore. It's a graduate tax, which is equivalent what it essentially is. So I can't get away from, so proportionate universalism says, I'm all in favor of things that are universal, but with effort proportionate to need. What I heard from, particularly from Matthew, was very moving, but I heard about pay people properly to do important work. You know, his uncle was killing himself with overwork because he wasn't paid properly. If he was paid properly for the vital job he was doing, if he was working the post office, by golly, we all need the post. It's a vital part of society, but he wasn't paid properly, so he had to kill himself with overwork. That isn't solved by universal basic income. The solution to that is paying people properly to do vital jobs, whether it's in adult social care or delivery. You know, that's what we should have learned from the pandemic, how vital these jobs are and how miserably paid they are. So people, where I began, a crucial determinant of health is having enough money to lead a healthy life. If it doesn't come from work, it's got to come from somewhere else. I don't like the idea of means tested benefits because of all, that's why I go for universality, because of all the stigma and the administrative costs and all the rest of it. What I've not yet heard is a case for universality, to make this basic income universal. And I'm entirely sympathetic with everything that Kate said about the importance of relative income as well as absolute. Universal basic income wouldn't solve the relative income problem, because you're still going to have hedge fund managers and you're still going to have well-paid professionals and middle managers and goodness knows what. So it wouldn't solve the relative inequality issue. The fact that some people can do more because they've got more money, and they take pride and they can buy their kids new clothes and all the things you can do with more money, all the things that go with the relative inequalities, the psychosocial effects. So I'm entirely sympathetic with what Kate said, but that wouldn't be solved by UBI because we're not going to stop people earning money. I don't think that's the proposal. So it wouldn't solve the relativity issue.
Thank you, Kate. Do you want to come in?
Well, it depends how you pay for your UBI, I guess. I suppose one could pay for it by taxing the hedge funds, and then you might be having an impact on relative income. I don't think we're in disagreement here, really. I think, for me, it's about thinking about some kind of universal basic income support as an addition to the other kinds of services that we think should be universally provided. So we should, of course, have free education. And I would like to see that applying to sort of early childhood and lifelong education, as well as universities as well. And some societies manage to do that better than we do. The National Health Service is so beloved of the British public that no politician feels they can really touch it. And there we are, providing something universal for everybody. And it's possible that we could think of a level of universal basic income that would acquire the same iconic status for the British public as something that allowed a certain amount of dignity, a certain amount of freedom to do things like raising children or caring for elderly relatives, which are not solved by higher pay in the labour market, because those are unpaid contributions to society, but also allowing people to explore other options, perhaps become entrepreneurial for a while. So I think there's a lot of potential for some level of income for all adults to be an additional support for health and well-being in our society. But it does take some serious thought about how it's paid for and what level it would be. I've seen a lot of discussion in the chat. A lot of people are sharing lived experiences of great suffering that would be addressed by having some level of universal basic income that would provide both dignity as well as material support. So I think there's a lot for us to discuss, and I'm also grateful to a lot of the comments in the chat about the trials in Canada, where we have seen strong positive effects on hospitalization, which are obviously cost savings for society. But we do still need more thought and more research here about whether we are talking about something that's universal for everybody, or if it is just universal for particular age groups. We used to have universal child benefit, of course, which you can think of as a sort of universal basic income of a kind for particular family structures. So there's a lot to still discuss, but some kind of universal basic income support, I do feel would go quite a long way to address some social and health problems, but I certainly don't think it's going to solve all of our problems. And I certainly wouldn't want to see it funded at the expense of us losing other universal basic services and other kinds of social support and provision.
Agreed. I think that's a very important point. Where does the money come from? It shouldn't be borrowing from other purses that are providing essential things. Matthew, did you want to come in on anything that's just been said?
Yeah, I just think the point really is that this is a redistribution of income rather than just an introduction of new cash into the economy. There are means of funding this through fiscal reform that are sensible and can be costed fairly easily and effectively, and that's what we're doing at the minute with Stuart Lansley and Howard Reid. And the kind of benefits that you might get from a substantive UBI are really significant in terms of health savings. When you think about the cost of stress-related ill health, you think about the cost of lifestyle diseases, these are hugely impactful on public budgets, and reducing them would make a significant impact in terms of affordability of a UBI scheme.
Can we speak a little bit more about pilots then that are designed to gather more data on the health impacts? And yeah, do you think these would be a good thing? Are they possible to design? Do you want to see them happening in the UK?
Can I just come in on the cost question?
Of course.
For me, the argument that I've heard from both Kate and Matthew for UBI is not about cost saving, but about dignity, about quality of life, about providing a basic from which people can plan their lives, do things. In one sense, let me overstate the position. In one sense, I couldn't care less if it was a costly way to do things. That's not the issue. We've got lots of money. You know, all this bullshit about austerity is an absolute necessity. There was no other way. It's a political choice. It's not lack of money. But we know that because we saw it at the start of the pandemic. The same political party that told us this ghastly nonsense about austerity, there was no alternative. We had to take the tough choices. The poor dears had to take these awful tough choices and they suffered terribly. The moment the pandemic happened, we could spend anything, absolutely anything. It was very clear we could do that, and we did it. So the cost is not the issue. If universal basic income was a way to create better and more equitable distribution of health and well-being and to allow people to lead dignified lives, then for me, that's the compelling argument, not whether it might save on healthcare costs. It's like the prevention argument. I've never, ever been convinced that the argument for prevention is to save on healthcare costs. The argument for prevention is people can be not sick. that's quite a good thing to have. Never mind whether it saves on healthcare costs. And I don't think the politicians believe it for a moment. You know, if they want to go to war, they don't ask, will it save money? They just go to war. So why should they ask, will it save money, if they're talking about people leading lives of dignity? So I don't think the cost issue is the right one. You can ask, and I've argued, I had a long argument, a friendly argument, with a senior economist about this. And he said, look, you want to reduce poverty to reduce crime. How about if I told you that if you installed more cameras, you could reduce crime more cost efficiently? Just put more cameras around everywhere so the surveillance is more extreme. So you could see why a politician would go for cameras rather than reducing poverty. Well, yeah, I could. That's why I don't want to have the cost-effective argument, because there are other good reasons for reducing poverty. And so what I'm hearing is that there are good reasons for people having a security that allows them to do other things. As you can hear, that I'm sympathetic, but I'm not convinced that that's all we need to do, because we need to think about the cost of food, about the supply of housing, about how good transport is, about the availability of subsidized childcare. You know, in the United States, they think it would turn America into Marxist-Leninist state if they had paid maternity leave. What? The US is not the only country with no paid maternity leave. Papua New Guinea and Suriname, there are three. Every other country has paid maternity leave, but that's a particular rant of mine. So universal, giving people money when they haven't got it is a benefit, no question about it. But that doesn't get away from the need to have universal basic services as well.
Michael, if it's not a cost argument, all of those things then are doable. And I think, you know, as Kate said, you know, UBI would supplement a whole range of universal services. It's not a cost argument. What is the reason not to?
It's so your uncle doesn't die at age 60 or because of overwork and because of leading.
But no, I mean, but what's the reason for opposing it then? Why not be convinced by it?
I'm not opposing it. I'm asking questions. You know, I'm not mounting an argument against it, and I'm certainly not doing it on cost grounds. I'm asking the question, and Kate responded to it, I think, in an interesting way. You know, if it's going really to be universal and at a meaningful level, are you going to give up other things to do it? So in one sense, yes, the cost question does come into it, but I wouldn't argue it just that it saves healthcare costs. I'd argue it on the quality of life. That's, for me, the argument for it.
I always think it's quite nice to have a cost argument up your sleeve in case social justice arguments don't get you far enough. And having had my babies in the United States as a working mother with no paid maternity leave as well, I really hear how certain kinds of benefits are important in addition to whatever we would do around universal basic income support. I think one thing I'd like us to talk about is the gap, if we could, between public opinion on this and the policy political world. So Matthew, I think you've been doing some work, haven't you, with colleagues in Newcastle around people's opinion about UBI. And I think it's similar to what we see in the British Social Attitude Survey year after year after year, is that the public are quite in favour of welfare, of UBI, of progressive kinds of policies that support health and well-being at really high levels, 70%, 80%, 90%. And yet, although we might get discussion in talking shops like this, we are not seeing mainstream political discussion of this issue at the moment. Now, the Labour Party did have it in its manifesto in the time of Corbyn, but it's no longer a Labour Party commitment. Quite different things going on in the devolved government. So I'd really like it if we talked a bit about the gap between public opinions and acceptability and who we're not hearing from in those sorts of surveys, and where we are at really in the public debate.
Yeah, so I suppose just to build on that, Kate, the work that we've done has been in at a national representative level, both in the UK and US, but also within red wall constituencies. And what we found from the beginning of the pandemic is, as you say, really high levels of support for UBI. Those levels of support for UBI sometimes are brought down when you present people with a dilemma of supporting UBI or a needs-based alternative. But the levels of support remain really quite high. And the work that we've done in the red wall constituencies is particularly illustrative, because here we have a population that is increasingly referred to in exotic terms as culturally distinct from the metropolitan centre of the UK in London, Manchester and elsewhere. And it seemed to hold a series of almost progressive, reactionary political values that set it apart from progressive public policy. But what we found is that there is quite significant levels of support for UBI when it's presented in instrumentalist terms. If there is a tangible benefit to people presented in terms that they can understand in relation to their lives, their lived experience, then the level of support is high. And what we find is that there's a fairly consistent level of opposition, fundamentalist opposition, which hovers around the 7 to 10% mark. And that 7 to 10% cohort can still be persuaded by arguments that they themselves produce about UBI. So we've done some adversarial collaboration with those fundamentalist opponents who come up with the idea of things like a pension for life, a living pension, a pension for people who are working, who are hardworking, who are aspirational, that enables them to get ahead in life. And that narrative, when presented to people like them who fundamentally oppose UBI, leads to a significant impact upon people's perception of the policy. So you get something between a 30 to 50% increase in people's levels of support when presented with those narratives. So that all presents a biddable population that progressive politicians can speak to really quite effectively. Unfortunately, we just haven't got an opposition party that's willing to engage in that.
Thank you, Matthew. It's super interesting work there. I'm going to hand over to Laina, who's going to bring in some audience questions now.
Hi, I'm not going to use my host privilege to ask my own questions, but I am going to pass over first to Sean. I'm just going to, if you have put a question and you haven't got a message from me, I will ask you if you want to unmute yourself. I'll allow you to talk, and then you can ask your question in the panels. If not, I will ask your question from the Q&A or pulled from the chat. So Sean, you're up first. You should now be able to unmute yourself.
Thank you. Is it coming through clearly enough?
Yep, we can hear you.
Thank you. The etymology of the word leisure relates to license, to be free, to be permitted. And a form of upstream thinking is to look to the etymology of words. So I want to focus on this concept of leisure as a component or as an outcome of basic income. We often hear it defined as free time, but that's a commodified version of free time relative to work. But a classical Greek definition relates to civic participation. So can you please discuss the human right to leisure that's based in Article 24 and Article 25 of the Universal Declaration of Human Rights? I'll just be brief and finish there.
Yeah, thank you, Sean, for that question. It's a really, really interesting one. You know, the idea of leisure in our common use, I think, tends to, we think about that as our lazy time, right? The time when we are not working, not employed, but its meaning is much more related to our capacity to live well and be well. If we think about leisure time as time in which our minds are free to wander, or we are free to pursue pursuits that are not marketized labor. So we might be caring for one another, we might be pursuing creative pursuits, we might be volunteering, we might be doing other things, and we might choose to have, I suppose, over our lifetime, periods when we are in paid employment and periods when we're not. And so if we think of leisure much more broadly, it's as important to us as food and sleep and many other things. So I think to posit it as not just sort of free time, but our right to be free is a really important distinction, and I'm grateful to you for making it. I often think about my colleague Danny Dooling once said that it's really only at the weekend that people are free of inequality, because it is at the weekend that they are not in paid labour where they perhaps feel exploited or that their hours are long, and they are free to be themselves and sort of to live the life of their choice. So I think you're making something of the same point. Thank you.
Thank you, Kate. I just want to say Michael needs to get away to another engagement now, so I'm just going to invite him to say any final comments and thank him for being here with us this evening.
Question about leisure is interesting. When I began the Whitehall 2 study, I interviewed, before I did questionnaires and all of that, I interviewed hundreds of civil servants and talked to them. And what was very clear is that if you look at a whole range of activities at work, outside work, social activities, family activities, the higher the socioeconomic level, the more they were engaged in a whole array of activities. So it wasn't just, well, they were working so hard and they didn't have time to do other things. They were more likely to be involved in the church and the cricket club and the professional association. And then when we did the 2010 review of inequalities, look at travel. Every mode of travel at that time in 2010 showed a social gradient. Even walking and cycling, the higher people were in the social level, the more they moved about. And I thought we weren't quite so sensitive to the climate crisis, but I thought, I don't know if moving about is a fundamental human right, but if it is, it's yet one more that's unequally distributed. Now we think, with climate change, how you move about is rather important. Cycling, walking, public transport, quite good ways of moving about, but they were very unequally distributed. So what we see is leisure, work fulfillment, money, social relationships, moving about. All of those are unequally distributed in society. And I'm very open to any proposal that would redress some of those inequalities. If some form of basic income would do it, be it universal or non-universal, I'm very open to it. Providing services, making sure, and Kate said about the NHS, free at the point of use. Primary education, free at the point of use. Secondary education, free at the point of use. University education costs a bomb. So making sure that the array of services available mean that individual income is not quite so important as it is when those services are not available, but providing the means for people to engage fully in society in a much more equitable way than is currently the case. And so I am sorry that I have to leave.
Don't be sorry. Thank you so much for being here with us. Thank you. Matthew, did you want to add anything to the leisure question?
Yeah, the stuff on leisure is really important. So my brother did some work, my youngest brother did some work a few years ago on the activity trap. And there's just consistent evidence to suggest that the conditional nature of the benefit system means that people are deprived of the capacity to engage in health promoting activity. And often what you find is, if you are unemployed, you've got too much time to fill and you can't fill it gainfully because any activity will undermine your receipt of benefits. If you are employed, you've got no time to engage in leisure, so you can't make good use of the benefit of employment. This is a really dysfunctional society in lots of different ways.
Yeah, thank you for that. We're going to move on to one more question from Meenakshi Sharma. I hope I said that right. I'm going to unmute you now. You should be able to unmute yourself and ask your questions of the panel.
Hi, can you hear me?
Yep, coming through loud and clear.
Lovely. My first question is, which I think has been answered quite a bit already, but isn't there a need for a wider conception of UBI, which includes a certain level of utility services, such as gas, electric, water, broadband, and housing costs? And this would necessitate the public ownership of these utilities and of much housing. Shall I ask the second one at the same time?
Yeah.
And the second one is, with the global climate change, biodiversity, COVID, and refugee migrant flow crises, isn't there a case for a global UBI system which would address issues of the historical exploitation of many countries and the industrialization which has caused climate change?
Both really, really good questions. I think we have talked quite a lot about the first question, Meenakshi, about the need to not only focus on provision or development of a universal basic income, but to think also about the provision of the services that go alongside that. And I think Mark Donovan in the chat has posted something really, really interesting about rethinking from first principles how we structure our society so that we are thinking about low cost, clean, decentralized energy, he says, localized food production, low cost modular manufactured housing, affordable, automated, shared transportation, a package. Our world is changing and we do need to change to it in response to the climate emergency, biodiversity loss, to the global issues, including refugee and migrant crises that you raised. And this seems to me this is the time to be thinking about whole systems change and structural societal change. We have been faced by a universal crisis, and it has focused lots of people's minds, I think, on the potential for change. So this is the right time to be thinking about those. The trouble is, of course, bloody hard doing it in one small country. The idea of doing it globally, when we actually don't have any notion of some kind of international constitution for doing things other than the United Nations, which manages some things and not others. I mean, for anyone who's an old fan of Star Trek like me, you always wanted to belong to the United Federation of Planets and see everybody doing things sort of universally and all together. Well, it's such a long way from that. But I'm sure it's in humanity's future. And I'm sure that because of the climate emergency and the need to structure things differently, we will see rethinking along the lines that Mark is perhaps suggesting in the chat. We really need transformative economic thinking. And universal basic income is a component of that, potentially. But we really need whole systems-wide transformative economic thinking. And that means we need transformative leadership. And that's what we're lacking. And that's why we're in the place we're at and having this kind of debate, rather than seeing this kind of debate happen at the levels of power in the power making corridors where it needs to happen to create the kind of change that I think everybody here on this call is in favour and others talking about and would wish to see. Sorry, Matthew, it's me banging on. You'll forgive me.
Oh, fascinating. So I couldn't agree more. And I think so. The pandemic really has highlighted the limits to the ability of the market to deal with any of these significant challenges, where private enterprises helped us to address the challenges of the pandemic or climate crisis. It's been through the government intervention, subsidization of private enterprise, and provision of state support for intellectual development of resources. So I think this really does highlight that it is only the state that can get us out of these particular crises. And for the first time in a few decades, actually, the interests of public policy makers and politicians more broadly are aligned with the state being involved in the economy in a much more robust and thoroughgoing way. And you can see that today, even within the Conservative Party, the Tories have overturned decades of ideological orthodoxy in ways that Labour really have failed to do. And I think one of the challenges that we face in this society is that our politicians come from a very, very narrow social group that is materially comfortable, that feels that it's secure and isn't vulnerable to the kind of crises that we've been talking about. Where our politicians from different backgrounds, where they're faced with the sort of challenges that we're talking about, they may come up with much more divergent responses to these challenges. It's a problem of Britain and its class inequality.
Lena, before we go to the next questions, can I answer one directly that's in the chat? Because somebody's
Absolutely.
saying, yeah, Clive Lord, I think, saying I made no mention of UBI in my chapter, Be Agnostic About the Growth in Donut. That's because it's not my book, Clive. That's Kate Rayworth, who wrote Donut Economics, and I wrote a different book. But it's okay, because we often get confused in meetings. Somebody will say, oh, I loved your donut book. No, didn't we? But thanks for that comment.
No worries. I'm going to call on Reinhardt now. You should now be able to unmute yourself and ask your questions of the panel.
Okay, thank you, Lena. Can you hear me?
All good.
Can you hear me?
Yep.
Okay. I actually have got two questions. One, I'm actually from Leeds, UBI Lab Leeds. Question one is, I saw in one of the slides that basic income would reduce inequality. I know this statement is frequently made. However, I do not understand it, because unless you have an upper income and wealth limit, in my assessment, basic income can provide a sort of economic secure or financial security, but it cannot reduce inequality in society. So I think, please comment on this assumption. And the second one is, I mean, in Germany, social health insurance, in Britain, the NHS was introduced, and I cannot remember that any sort of pilots and experiments were done, but it was a political decision to introduce it because it was seen as a positive step. So my suggestion is, rather than arguing for pilots and experiments, we should just introduce it for a period of 10 years and assess it, accompany it with academic research. And if we come to the conclusion that it's a bad idea, we abandon it. Or if we come to the conclusion that it needs modifications, we modify it, rather than fighting for sort of pilots and more experiments, which will not, I think, convince anybody who is not already convinced. Thank you.
Okay, so thanks, Reinhardt. If we had a universal basic income, certainly it would reduce income inequality slightly, even if you did nothing about top incomes, because you would be providing a better level of support to those people who have no income currently. So there would be a small impact on income inequality, but it could have a larger impact on income inequality if you funded that universal basic income through progressive measures that might include taxing wealth and incomes at the top. So if part of your funding for your universal basic income came from reducing top incomes and wealth, then you would have an inequality reducing impact. So it all depends on how you do it. I think it's a really good point about pilots and testing. You know, yeah, back when we introduced the National Health Service, we didn't do it because we got a randomized controlled trial that showed that it was better for the health of the public. Sometimes you do things because it's the right thing to do, and in fact, we've implemented health care services and treatments when they are not cost effective because we think it's the right thing to do at times. So we don't always need to have that kind of evidence base on which to act. But the current policy world in which we exist does ask for it. You know, there's very much a political and policy making climate that says if you haven't got the evidence that this works, we won't consider it. And I think that's why we think about modeling simulations to see if a proposed UBI would benefit health under certain circumstances and be able to say something about it. That it's why we think about pilot testing the feasibility of a trial of universal cash transfers. So I think there are good reasons why in our current political and policy making climate, we do things that try and improve the evidence base. But it would be wonderful actually if we had charismatic leadership that didn't require that and did do just what you said and said, we're going to implement it, we'll do it for 10 years, and then we'll see where we got to. I'd be hugely in favour of that as well.
Yeah, so I agree with the fiscal reform argument for inequality reduction, and I think beyond that you get the impact of domination mitigation. So it's one of the, on a macro level, there's capacity to reduce inequality, but actually on a micro level, in terms of people's individual relationships, people's work environments, you've got the capacity to free people from their dependence upon other people, free people from their being dominated in abusive relationships by giving them an out. And that's inequality mitigation in a very micro sense, but it could contribute to quite a transformative impact across society. And I think I agree with Kate about the evidence development, but I also think the most likely route to implementation is probably just going to be some response to a crisis. I mean, we've got a government that's just spent hundreds of billions paying Britons not to work. This is, in contrast, quite a reasonable response to future pandemics and future crises.
On that note, I'm going to ask Mark Donovan to ask his question just as we're moving to kind of how we turn this into action. Let me just, you should now be able to unmute yourself, Mark.
Thank you, Laina. My question is, what do you think are the levers that will change public sentiment sufficiently to allow us to move to UBI?
But I'm not sure that it needs to move. I think people respond to circumstances, respond to material circumstances. We've got a brilliant set of circumstances at the minute which makes the public biddable in terms of support for these transformative impacts, transformative public policies. We've just got an opposition that has, for a range of different reasons, decided to recluse itself from transformative public policy. That's just the problem that we face at the minute.
Kate, did you want to add anything? You mentioned earlier that devolved governments are being more bold in their talking of basic income than central.
The devolved governments are always bolder, aren't they? And more progressive in their policy making. I agree with Matthew. We don't need to actually shift the dial on public opinion. It's there. You know, it's pretty robust in survey after survey that the public are in favour of universal basic income. And I know that we've got people here from the UBI labs across the country, and we know that local authority after local authority has asked that they be allowed to be a pilot site for a trial of UBI in the UK. So I don't think it's shifting sort of public demand that's the issue. It's how do you move something which I suppose in past decades used to be considered a bit of a sort of fringe idea or a bit of a far left idea, not respectable. You know, how do you shift that politically so that the mainstream political parties, and somebody did point out in the chat that this is Green Party manifesto commitment, we do know that, but with one MP, that's not going to get us to UBI. How do we get to the point where a mainstream opposition likely to be, all right, we're talking about the Labour Party. How do we get the Labour Party to re-adopt UBI as a manifesto commitment? I don't have an answer to that, but it's certainly the question that we do need to be asking. Current Labour Party leadership don't actually even want to discuss it as an idea. They don't want to think about having that back in their manifesto. So I don't see that there's much wiggle room for us at the moment with current Labour Party leadership. And certainly there's no appetite for talking about UBI among Conservatives, even though it would help them meet their much vaunted levelling up agenda. And even though they did introduce forms of UBI in the COVID crisis.
Do we have time for one more?
I think so.
Okay.
Quick one. Only one though. No double questions for this one.
No double questions. All right. Luke, do you want to ask your question? I'll let you unmute yourself.
Hi, can you hear me?
Yep.
Perfect. My question is just quite a specific one regarding the growing focus on adverse childhood experiences. The evidence is kind of increasingly showing that poverty and adverse childhood experiences are kind of inherently linked. And I guess, particularly Kate, with the work you've done, I'm intrigued like what pathways poverty leads to adverse childhood experiences, and also what role a basic income could have in preventing that happening in the first place, and potentially supporting people who've suffered from ACEs in their recovery, and whether we should argue for a UBI with specific focuses on creating like a trauma-informed society and preventing childhood trauma. I think there's a question in there somewhere.
Yeah, there's a question there. So ACEs, adverse childhood experiences, are linked to health and well-being for children and for their later health and well-being as well. And they are an increasing focus of policy and concern. So adverse childhood experiences are things like experiencing violence in the home, growing up with parents with mental health problems or addiction problems, divorce in the family. What goes into that list of adverse childhood experiences differs from definition to definition, index to index. Clearly, those are socially determined. All of the adverse childhood experiences are more common at the bottom of the social ladder than they are at the top, and they exhibit a social gradient. So UBI does have potential to alleviate adverse childhood experiences and therefore improve lifelong health and well-being. If you had a completely universal basic income, then you would expect it to be beneficial for children because it would be being paid to families, and perhaps there would be a payment, according to family size, so increased with number of children. But even if we decided to start our UBI journey in the UK with targeted UBIs, we might start with families, or we might start with payments during pregnancy, or we might start with young people, as I'd suggested earlier. So there's potential for thinking about how you roll out UBI, I think, that might lead you to focus on more vulnerable families first.
Did you want to add anything there, Matthew?
No, I mean, how could I add anything to that? That's, yeah.
Well, that's taken us to 7:30 then. So I just want to say a massive thank you to you both, Matthew and Kate, and to everyone asking wonderful questions and adding their insights in the chat that's joined us tonight. Big thank you again to Michael, who's already left us. But yeah, you'll be able to watch this back on YouTube, and I'll send the links round to the links that people have shared in the chat. I'll pop them in the follow-up email. And yeah, another massive thank you for being part of this evening, and hope to see you all again at the next event. Thanks.
Thanks for having us, Cleo.
Thank you, Kate.
Thanks, Lena. Nice to see you, Matthew. Bye.